Erectile dysfunction, also known as impotence, is a very common sexual health issue among men. It is defined as the inability to develop or maintain an erection firm enough for sexual intercourse. While erectile dysfunction itself is not life-threatening, it can negatively impact quality of life and relationship satisfaction if left untreated. Exact erectile dysfunction statistics are hard to determine, but it is estimated that over 30 million men in the United States experience some form of erectile dysfunction. The rates tend to increase with age. Around 40% of men aged 40 to 70 experience erectile dysfunction to some degree. However, erectile dysfunction is not exclusively an older man's problem. Younger men can experience it too, due to psychological or physical factors. So what exactly causes this condition? There are often multiple contributing factors that lead to a man developing erectile dysfunction. Understanding the root physiological and psychological causes is key to properly diagnosing and treating it. Physical causes of erectile dysfunction. A majority of erectile dysfunction cases have an identifiable physical basis. Some of the most common physical causes linked to erectile dysfunction include chronic health issues. Diseases like diabetes, hypertension, heart disease, kidney disease, and chronic lung disease can damage blood vessels and nerves involved in achieving an erection. Approximately 70% of men with diabetes will experience erectile dysfunction at some point. Neurological damage. Conditions that damage the nerves needed for an erection like spinal cord injuries, multiple sclerosis, Alzheimer's disease, Parkinson's disease, and stroke are significant physical causes of erectile dysfunction. Vascular disease. Poor circulation from conditions like atherosclerosis, hardening of the arteries, high cholesterol, and obesity can impair blood flow needed in the penis for an erection. Smoking, which promotes vascular disease, is another major physical risk factor that increases the likelihood of experiencing erectile dysfunction. Hormonal imbalances. Low testosterone levels or other hormone imbalances can detrimentally impact sexual functioning and the ability to achieve an erection. Testosterone levels normally decline with age. The medication side effects. A wide range of medications used to treat conditions like high blood pressure, depression, anxiety, heart disease, and cancer are known culprits that can cause erectile dysfunction as a side effect by inhibiting libido or impairing vascular function. Pelvic surgeries or injuries. Surgeries in the pelvic area, like prostatectomy for prostate cancer, are highly associated with erectile dysfunction as they can potentially damage nerves involved in erections. Pelvic fractures can also contribute to physical erectile dysfunction. Lifestyle factors. Being overweight or obese increases erectile dysfunction risk due to the additional strain on the cardiovascular system and nerve damage from lack of exercise. Excessive alcohol consumption and recreational drug abuse have also been linked to physiological erectile problems. As you can see, many chronic illnesses, injuries, and lifestyle factors can negatively impact erectile function through their effects on circulation, nerves, or hormones responsible for achieving and maintaining an erection. Addressing underlying conditions and avoiding risks helps reduce physiological erectile dysfunction. Psychological causes of erectile dysfunction. While physical causes are often at play, psychological factors should not be overlooked as major contributors to erectile dysfunction as well. Stress, anxiety, depression, and relationship issues can all disrupt the brain-body connection needed for normal sexual response. Some examples include performance anxiety, the pressure to perform sexually, and fear of not being able to achieve or maintain an erection can become a self-fulfilling prophecy for erectile dysfunction. This type of situational erectile dysfunction is very common. Low self-esteem. Men who lack confidence in themselves or their sexual abilities are more prone to developing anxiety that manifests as erectile dysfunction during intimacy. Relationship problems often lower self-esteem too. Stress and depression. High stress levels and depressive disorders disrupt hormone balance and impair arousal. They also increase anxiety, which promotes situational erectile dysfunction. As many as 70% of men being treated for depression report some form of sexual dysfunction. Guilt over sexual orientation. Struggling with sexual orientation identity or guilt can manifest as psychological erectile dysfunction through creating mental blocks against intimacy. History of sexual abuse. Past trauma like sexual abuse, unfortunately, increases risk of developing sexual anxiety that hinders healthy sexual function later in life, including erections. Porn and masturbation addiction. Excessive porn use and masturbation that replaces physical intimacy can disrupt dopamine balance in the brain and desensitize normal arousal patterns, potentially causing erectile dysfunction. As seen above, psychological issues ranging from everyday stress to more serious mental health concerns are highly prevalent causes of erectile dysfunction when left unaddressed. Incorporating counseling or cognitive behavioral therapy, along with medical treatment, can help resolve the root psychological underpinnings. Preventing and treating erectile dysfunction. Understanding both physical and psychological risk factors for erectile dysfunction provides insight into preventing its onset or progression over time. Making healthy lifestyle modifications and properly managing chronic conditions are key preventative strategies. Some recommendations include: quit smoking and limit alcohol intake. Follow a heart-healthy, Mediterranean-style diet, low in refined carbs and saturated fats. Achieve and maintain a healthy weight through portion control and regular exercise. Manage stress through relaxation techniques like deep breathing, yoga, or meditation. Communicate openly with your partner to foster intimacy and reduce anxiety. Seek counseling if past trauma or sexual orientation issues are unresolved concerns. For men already experiencing erectile dysfunction, seeing a doctor can determine if an underlying medical condition requires treatment first before tackling the dysfunction itself. Options include oral medications like Viagra, Cialis and Stendra, alprostadil injections/suppositories, penile implants, or counseling, CBT. A combined treatment approach customized for each individual often yields the highest success rates. Overall, erectile dysfunction has become very prevalent in contemporary societies due to rising rates of chronic illness, sedentary lifestyles, and ballooning stress levels. Implementing prevention strategies and properly diagnosing and treating root causes with a combination of medical and psychological interventions maximizes chances of overcoming erectile problems over both short and long term. Maintaining a healthy mind and body sets the stage for optimal sexual function. Thank you so much for watching. Please like, subscribe, and share this video. See you in my next video, and bye for now.